yes, we made them hard work. Olive, do you want to tell something? I just start by saying that my colleague Hilde is not here, but she worked and lived during 4 years as a midwife in Rwanda. She knows Rwanda very well. So that was also very important and interesting that she knew the culture very well. And also that we knew each other. We started with a strong partnership. And I think that that's also something that was very important also for this project, that the aspect of culture is very important. So it's really important now, like Rwanda, and you see these are strong midwives, that they can share it also for Africa and other developing countries. Olive, that you have to unmute. Yes, thank you.
Yes, yes. Yeah, thank you very much, Miki and colleagues. Yeah, as we are sharing our experience, we are very happy and glad to share good experience. It was a long journey and hard, I can say. And also, as she was saying, we met our colleague Hilda, and we used to have like 8 years partnership before with your university, but in exchanging students only. They were coming here for clinical. But for that e-portfolio, it started when Hilde was connecting us with the head of department, Miki, where we started to see how we can write a grant when the call of virus was out. And we wrote a grant. Donatilla and Miki were a promoter, but at the beginning I was with Hilde in touch because we were having students from your university. And since that time, we wrote that grant and it succeeded. And from success, we had many experiences we can share, the delay of bureaucracy, the signatures, that local commitment, as Professor Vark was saying, and we tried our best to own the project and work hard day and night from our side, and even sometimes comes to Arteveld to work on the project up to the starting implementation. And before starting implementation, we have done like a baseline study, if I can say, saying that we used to have paper-based portfolio. I think colleagues from Ethiopia and Kenya or this East African region, they have that paper-based portfolio. I've been in Uganda, they are having those paper-based portfolio. We are sharing same experience, but from that paper-based portfolio, even though it was helping us, we wanted to move from paper-based to digital. And it changed, it is not easy, and implementing that technology in a context where network is not easy, devices for supervisors, mentors, and the students, but also tried our best to share with the project. We bought some computers to the centers. We were using two settings like pilot study, Muhima and King Faisal, and the supervisors, research people, we were committed, if I can say, day and night to see how we are progressing. After that baseline study or baseline research of checking how paper-based worked, we implemented, we trained the mentors, supervisors, and the students to use this e-portfolio. And colleagues from Belgium came to us, trained us, and we went to train also mentors and supervisors and the students as well to be on the same level and to have common understanding of this e-portfolio use. And we started implement it for some months because it was a project, it was a pilot, it was not taking like a whole year. And at the end of implementation of like 3 months, we evaluated and we went for the endline study, if I can say, to see the experience as well of e-portfolio. And we compared, it was very nice. I can share many experiences, as Professor Vark said. If we have that big meeting regionally, we can disseminate and share more information and how effort we are committed to see how we can succeed regionally. Thank you very much.
Thank you. Alice, do you want to add something?
I have a question.
Thank you. Thank you also, Rif, for saying about our experience. What I can add, also it helps us to learn because we were not expert in research, especially in qualitative research, but now we learned a lot during this journey. And also we have done publication, and we hope other will be published soon. Also, now the e-portfolio will not be implemented only at the school level. It will be implemented at the college level, where maybe other school they have the component of clinical, but they can use it. That's why I said it can be used, as the Professor Martin has said, it can be used in healthcare, not only in midwifery or in nursing. It can be used everywhere in healthcare. Thank you.
Thank you. Josephine, do you want to add something?
Thank you. I just want to emphasize on how we have really appreciated this portfolio, because we are really now using it to do the follow-up on our nurses and midwives who are doing mentorship in clinical practice. We are able to follow them up, we are able to give feedback, and we are able to evaluate, to monitor and evaluate their competencies, how they have gained the competencies in the mentorship. And we have tried to share with all nurses and midwives who are in the clinical practice. Thank you.
Something what I was thinking, we had also some meetings at the Belgian embassy. Do you want something to tell about that, Olive? How they did the follow-up?
Follow-up about?
About the project. We went to the Belgian embassy and they came to the university.
That Jana was saying. There were many activities done during this journey of the project. We had networking with international midwives and conferences. We make a follow-up. We went to present this project to the Embassy of Belgium and they appreciated. And also they came to our school. We presented what we have done and what we are doing. It was in the midterm, that period. And we presented all we have done from the first year, and they appreciated. Even they said we can scale up this project, this e-portfolio, to other professionals. We are discussing, it can go to other professionals. Also, they appreciated the Johan and the who, I don't remember. And also Inge came, we presented this so far where we were that time. All of them, they appreciated how the project was running for both sides, for financial activities and everything. It was successful.
Yes, maybe also the critical point from the embassy was the question of sustainability. And that is like now,
sustainability.
Yes, and that's also thanks to COVID, and you organized a workshop to discuss the IT staff, like you mentioned, and that is really something to be addressed in a long time, because now in May, the second one is piloted, the one of the university, I think. So that's also a cycle that will go on and see how this will work in Rwanda, and we continue the journey.
Yeah, thank you, Miki, for reminding that for the sustainability. Even the beginning, they were asking about members together with you when we are here. And even at the time they come to school, they ask the sustainability. It's the reason why we started thinking about how this can be incorporated in our e-learning platform. We used to teach on online, and it has been enhanced during this lockdown. COVID also has made us to increase the online teaching. And this e-portfolio also helped us to see how it can help with this period of like pandemic of COVID. That can help. For the sustainability is the reason why we have had that workshops to advocate, also to see with those e-learning officers how it can be customized in our e-learning platform. I think with this way, it will be sustainable.
Thank you. Professor Falken? Yes.
Yes, I just want to jump to some of the questions that were raised in the chat box. So there were quite a lot of questions about, is this applicable to other professions or other curricula? Our experience is already very wide. We go beyond the medical and the health profession. It's also already used in many other training programs and professional development programs, such as teacher education. And I think teacher education is also a very strong field in Africa, where a lot of needs are being addressed. The same in bioengineering, engineering, veterinary education. The only key condition is, of course, that this e-portfolio builds on a competency-based orientation. And of course, if your local curriculum does not reflect such a competency-based orientation, well, this should be added, in fact, to the project definition if you want to go ahead. Remember that in the discussion of our Rwandese colleagues, that they emphasized the strong responsibility also of students in the process, where they collect proofs to add to the competency definitions in the e-portfolio. Now, adding proofs is a kind of conceptual shift in many educators in programs, that they say, okay, the responsibility for evaluation is partly in the hands of our students, and we accept and we respect this proof being presented by our students as a good base for reflection and a discussion about the mastery. Of course, this new approach in assessment is part of this competency-based orientation in the new curricula. So if you ask us, can you do it in other professions, in other curricula? We always say yes, but then you should respect this condition at the level of this competency-based orientation and the shared responsibility between the institution, the professional setting like the hospital, and the students in collecting evidence as to the mastery of the competences and using this evidence as the base for a discussion about, are you okay as a midwife? Are you okay as a nurse? Are you okay as a bioengineer? So